The White House for us. Thanks very much. Let's get some more on all of this. Independent Senator Angus King of Maine is joining us. He's a member of the Intelligence and Budget Committees. Senator, thanks for joining us.
Thank you, Wolf.
We have lots to discuss. You're an independent. You caucus with the Democrats, but based on what you're hearing, do Senate Republicans have the vote count necessary to pass this Republican health care plan? First of all, take a look in the House and then in the Senate.
Well, I think it's going to have tough sledding in both places. I think there are enough senators that I've heard from, Republican senators, who I wouldn't say they're committed to vote against it because we don't know exactly what's going to emerge, but they're very skeptical. And as I think more and more people realize the impacts that this is going to have on their states, I think support is going to start to eke away. And I think we're already starting to see that in the House today.
So you're talking to these moderate Senate Republicans who aren't necessarily very enthusiastic. I've heard maybe 6 or maybe even a dozen Republicans, whether moderates or more conservative in the Senate, are not likely to go ahead with this unless there are some major changes. Do you see any of those changes coming?
Well, somebody said something today about negotiation. I haven't heard of any negotiation or any significant changes. And by the way, it's not all moderates. One of the loudest voices has been Senator Tom Cotton of Arkansas, and I think he's one of the more conservative members of the Senate, and he's been very critical. He said they ought to back off, take a deep breath, and start over. There's, this business about the CBO is just nonsense, Wolf. They're the nonpartisan referee, and in fact, the head of the CBO was appointed by the Republican leadership. He's a Republican, came out of the Bush Council of Economic Advisors. They're playing it straight. The only reason their estimates were wrong in terms of number of people covered back when the Affordable Care Act passed was the Supreme Court allowed the states to take an option on expanding Medicaid. About a third of them didn't expand it, and that accounts for the difference in the numbers. These numbers are the only numbers we have, and there's no reason that, the idea that they're no good and that they somehow made a mistake is it just doesn't pass the straight face test.
The Health and Human Services Secretary, Tom Price, said he believes nobody will be worse off financially as a result of this Republican plan. But you've said this plan, in your words, will hammer Maine, your home state. So why is he saying this? Do you think he has bad information? Is he lying to the American people?
I'd call it extreme disingenuousness, Wolf. I don't get, how can you take almost $1 trillion out of support for people having health insurance and then turn around and say everybody's going to be better off? It just makes no sense whatsoever. It is going to hammer Maine. If you were designing a health care plan to hammer people in their 50s who are working, making $20,000, $30,000, $35,000 a year, it would be this plan. If you're 64 years old, make $26,000 a year, your premium under the Affordable Care Act under Obamacare is something like $1,800 a year. It would go to $14,000 a year under the plan that's been proposed. That's just ridiculous. They talk about choice, and people can choose and have a choice, and they have access. Always be careful with that word access, Wolf. What that means is I have access to buy a Maserati. I can walk in and buy a Maserati, but when they tell me it's $200,000, I say, I'm sorry, I can't buy it. Having access is not the deal. Having coverage is what we're really talking about. So there's a lot of loose talk around here, but the reality is, and oh, by the way, about the cutting of the deficit of $300 billion, they've done that by shifting $880 billion of Medicaid costs to the states. I could cut the deficit too if we decided the states were going to handle the Air Force, for example. That's a phony savings. You're just transferring it from the federal budget to the state budget and calling that a lowering of the federal deficit. I guess it is, but it's merely shifting the cost to somebody else. So this plan, it gets worse and worse the more you read about it.
The press secretary, Sean Spicer, also said the CBO report, didn't account for changes to the FDA approval process for drugs, allowing health insurance to be sold across state lines to make it more competitive. Do you support those proposals? The assumption is they could help lower costs.
Well, certainly improving the FDA process. I think everybody agrees that that would be helpful. I don't see that as a big money saver. And this idea of selling insurance across state lines, you can do that now. We've got companies in Maine that are selling in 4 or 5 different states, and they have to qualify to do business in Maine. That's always been a talking point, but I've never seen where that's going to save anything like the kind of money that we're talking about here. We're talking about essentially almost doubling the number of uninsured people under this bill, according to the Congressional Budget Office. And again, the people that are going to be hardest hit are lower income and particularly older people. And I haven't heard anybody deny that, because that's really one of the heart pieces of this bill. The other thing that I heard Sean Spicer say was that the Obamacare is about to collapse, or it's in a death spiral. The CBO report explicitly found that that was not true. It said specifically that the ACA is now stable, and the new plan would be stable. But to keep saying that the ACA is in a death spiral, again, the only evidence, the best evidence we have, are the professionals at the Congressional Budget Office who are nonpartisan, or actually led by a Republican that was appointed by the Republicans, have said the current system is stable and it provides a basis for providing coverage to 24 million people that won't have it if this current plan is passed.
Senator Angus King of Maine, thanks for joining us.
Yes, sir.